Hi everyone, it's Renee again. In this voiceover, we're going to cover spina bifida. Spina bifida is a neural tube defect in which the spinal cord or the spinal column does not close completely. Myelodysplasia is a general term that we use for any malformation of the spinal canal and cord. Spina bifida is a specific type of malformation of the spinal canal. There is a YouTube video that is embedded in this picture. This is a short video, but it does go through the 3 different types of spina bifida. There are a few different types of spina bifida that we're going to talk about. Spina bifida occulta, meningocele, and spina bifida cystica, which is also called myelomeningocele. This picture shows the different types of defect that we're going to talk about. With spina bifida, the etiology is unknown, so we really don't know exactly what causes it. What we do know is that there is a genetic predisposition and a link between the spina bifida and a low maternal folic acid level. With spina bifida occulta, the defect is not externally visible, and it occurs usually in the lumbar sacral area. What we can see with these patients are specific indications. We may see skin depressions or dimples, a hemangioma, which is a non-cancerous growth, dark tufts of hair, or soft subcutaneous lipomas. All of these indications would be at the level of the lesion, and there are pictures on this slide of each of these things. Spina bifida occulta is usually diagnosed accidentally because it's found on routine radiographs. Meningocele is another type of spina bifida. Meningocele is when a membrane that surrounds the spinal cord becomes enlarged, creating a cyst-like sac that the meninges are within. This may not always be visible, but can be seen on an ultrasound or an MRI. With meningocele, the client may not always have a disability, and this can be surgically removed. Spina bifida cystica encompasses myelomeningocele. With myelomeningocele, a section of the nerves are exposed and visible on the outside of the body. With this type of spina bifida, we are going to see a visible defect, which is an external like sac protrusion, and you can see a picture of this in the picture that's on the slide. This will cause partial or complete paralysis below the spinal opening. Myelomeningocele occurs when a neural tube fails to close or fails to fuse at some point along its length. This accounts for the largest number of spinal cord lesions. Most lesions occur on the lumbar spine, and myelomeningocele may be diagnosed prenatally or at birth. 80 to 85% of patients with myelomeningocele develop and have hydrocephalus. With myelomeningocele, we don't know the exact cause like the other forms of spina bifida. Like I mentioned before, there is a genetic disposition, and there's a link between low maternal folic acid levels and neural tube defects. Routine care for an expecting mother is to be on folic acid 0.4 milligrams per day, and if there's a history of neural tube defects, they may increase that to 4 milligrams per day. Maternal serum alpha-fetal protein is drawn around 15 to 20 weeks of gestation, and it's going to be elevated when there's a neural tube defect present. If the result is elevated, they usually do an amniocentesis and fetal ultrasound along with other testing. Diagnostic evaluation is definitely a collaborative role for the RN. RNs need to be able to support the families in these situations. This is really where the caring comes in, and we want to help ease the family's fears about these tests. The RN can support the family by answering questions they may have about how the test is done. The clients are usually interested in what's going to hurt, how long it's going to take, how long will it be before they can be with their child. We already discussed the prenatal detection with the alpha-fetal protein levels. But what I do want to talk about is the therapeutic management, microsurgical closure of the myelomeningocele. This can be performed at about 19 to 25 weeks, but only in special surgery centers. So management of the newborn with myelomeningocele, the first thing we want to do is make sure the airway is patent, most important thing. We also want to prevent infection, and to do this, we're going to place a warm, sterile saline dressing on that sac. We want to protect the sac from any infection, and we want to protect it from any trauma. Care of the myelomeningocele sac. So preoperatively, we want to make sure that the child has a radiant warmer, and this is really critical due to newborns being at high risk for hypothermia. We want to perform frequent dressing changes and make sure that the sac doesn't become soiled. And if it does become soiled from stool or urine, we want to clean it very carefully to prevent infection or damage to the sac. We want to make sure that the infant is positioned prone, and we can do that through the use of diaper rolls, small sandbags, and they even have specially designed frames. For post-operative care, we want to make sure the child is positioned right. We never want them on their back because we want to protect that incision. We either want them prone or side-lying, but we do want their head elevated to promote drainage. For feedings, immediately after surgery, we're going to do IV fluids, and then there'll be NPO, and as they become stabilized, we can do NG2 feedings. Assessing the head circumference and the fontanelles, we want to make sure that we are assessing for increased cranial pressure. If the head circumference is getting larger or the fontanelles are bulging, then you know there's an increase in intracranial pressure and you need to report that immediately. So monitoring for infection. We want to make sure that the child doesn't get an infection and that they're already at high risk for this because of the surgery and at risk because of the myelomeningocele. So we want to make sure that we're checking their incision. We want to make sure we're monitoring their vital signs and ensure that the meninges and the cerebral spinal fluid don't become infected. Management of bladder and bowel function. Myelomeningocele is one of the most common causes of neurogenic bladder among children. It also can impair the bowel function of these children. You can have absent or decreased bladder or bowel function in these children. So it's really important that we teach the parents the importance of clean intermittent catheterization. So when we do catheterization in the hospital or in competency or in lab, we're going to do a sterile procedure, but at home, this is going to be a clean procedure. So the parents really need to be educated on how to do this and be provided with support before they go home. A procedure called a vesicotomy is also something that can be done. It is a surgical opening in the bladder to the outside of the body, usually in the lower belly, that allows for urine to drain. It prevents urinary tract infections or damage to the kidneys. A vesicotomy, though, is a temporary treatment. So this is just some topics for client and family teaching. You want to remember how overwhelming this really is going to be for these parents, especially if it's their first child. And it can be even harder if they don't have any medical background and they have to learn how to do all of these new things they've never done before. So you want to show them diapering techniques, how to do a clean intermittent catheterization. You can show them how to do range of motion exercises and ocular assessments. You also want to teach the family, if they still have an incision, how to monitor for signs and symptoms of infection in that incision. We want to teach them the importance of temperature. We want to they need to take their temperature. They need to look at their eyes. We want them to know how to look and monitor for signs of increased cranial pressure. We also want to educate on the importance of going to any follow-up appointments they may have. And we just really overall want to make sure that the parents know when to call the doctor if they think there's something going on with their child. Okay, so this concludes our Spina Bifida voiceover. As usual, if you guys have any questions, please feel free to reach out to me.